Hi, this is Dr. Bill Thomas, RealCareNowTV, brought to you by the Picker Institute. And as regular viewers know, RealCareNowTV is dedicated to bringing forward ideas, concepts, practices that advance the practice of person-centered care. And I'm really lucky this week to have with me Mick Finn from Ecumen, a person-centered organization doing some really exciting stuff, helping elders live with a lower level of medication. I want to start right off just by asking you about the Awakenings program.
And so the specifics of the program that we've committed to is a reduction in 3 years of the use of psychotropics that aren't accompanied by a diagnosis of psychosis. And the state's given us $3.5 million over the course of that 3 years to eliminate or reduce the use of that particular style of drugs. Primarily, the focus in the grant is primarily for people that with dementia. So that's kind of the.
Let's talk about that.
Go ahead.
Yeah. Right there, I mean, you're just hitting a button for me. And it turns out that some of the most important, most significant problems that people living with dementia experience can't be solved with drugs. I mean, is that something you're finding in the Awakenings program?
It's very much what we're finding. What we discovered is when we took people off drugs, the bad things didn't happen. The things that the drugs were supposedly going to prevent didn't recur. Not only did the behaviors that we were trying to avoid not manifest themselves, but as a result, the direct result of taking people off these drugs, they themselves became people again. And so that was the magnificent aspect of what we on the trial basis, what we were discovering.
This is really a person-centered care initiative, because what you're really talking about in many cases is giving an elder their personhood back. And I'm wondering, Mick, if you could talk to me about the response that family members have to this idea of reducing the use of psychotropic meds. How does the family react to that?
And of course, it's going to depend on the individual circumstance. We have what we call a covenant that we have people sign when they come to an Ecumen property, and it's a covenant between Ecumen and the person coming into the building. The person coming into the building pledges that they will not abdicate responsibility for their life. The fact that you come to a nursing home or to an assisted living apartment doesn't say, okay, Ecumen, you're now in charge of me being happy, me being successful, me fulfilling who I am at this particular part of my life. Our job, Ecumen's part of the contract, is to do what's in our power to make sure that you are successful as you continue to maintain control of your life. And so this Awakenings is a way of getting back closer to that, where that person does have a life to be proud of, to be happy with. We're saying we have a different way of providing care than through drugs, and that's through this, as you call it, person-centered. There's a lot of different names for it. The family is integrally involved in that. And so if we're successful, then this aspect of the conflict with families that happens, for the most part, we're not running into it.